Assalamu alaikum warahmatullah. Auzubillahi minash shaitanir rajim. Bismillahir rahmanir rahim. Augmenting the healer, AI, how AI and data science are redefining diagnostic medicine. The perspective that I'm coming from is I deal with data all day long, and it comes in spreadsheets, but I try to present it in a way that it tells a story and present solutions to problems, and that's where I'm coming from today. Allah burdens not any soul beyond its capacity. Medical knowledge today keeps increasing daily. The capacity for human beings to keep all of that, statistics, knowledge, clinical trials, in mind is an impossible task. An article in National Library of Medicine researched the growth of data sets. From 2008 to 2011, it grew 3 to 10 times in certain cases. And I mean, if specifically talking about scans, MRI, it grew 27%, CT scans, it grew 30%, MRI, 32%, all that data just stored in backroom storages. You don't look at it, it's just collected. And going through it is humanly impossible. And I've seen doctors who are vigilant and they want to give the best for their patients, and they're looking at different trials that are coming up. They stay in the know. But I've also seen doctors who are not able to, and they're sort of placent, and they're like, okay, what are your symptoms? Here are your charts. Here are the numbers. Connect the dots. Here's the solution. But they don't see you. And that's where the issue comes in. Diagnosis is hard not because doctors aren't smart. It's hard because biology is noisy. There's so much going on in everybody. When you come in, you say the same things. I have sniffles, I have a sore throat, I have stomach aches, and they're like, oh, flu. Oh, we can test for it, but it's not going to be definitive because there's so many strands. They're only looking at the facts. I interviewed a complex care social worker last month and asked her about how they collect data. They said that we collect it from the moment the patient steps into the clinic, the hospital, or urgent care until they leave, and even after they try to get their feedback. And I was like, who looks at that data? And how often do they review it to see what was the problem? Like, a committee comes together and looks at it maybe twice a year. Twice a year for patients who've already left, who've already been diagnosed, treated, and how they were treated, they're not, there's no profanity on it, there's no immediate effect for that patient. They're gone. National Academy of Medicine reports that diagnostic error shows that 1 in 10 diagnoses are wrong. And this contributes to almost 10% of patient death. Say, oh my Lord, increase me in knowledge. AI is here to assist the doctor, not replace them. Provide the tools for them to be successful, to have the knowledge, to have the confidence to say that yes, this could be this, and we should try it and see if we succeed, and then come back and see if we didn't. What tools does AI provide? AI eye to see the unseeable, the AI librarian, the one who can look up references in seconds, the AI assistants who can take the notes for you so that you can pay attention to the patient, see how they react, see how they present themselves. Are they fatigued? Are they jovial? If they're saying that these are my symptoms, but they're jovial. It could be something psychological. That doesn't mean it's something physical. You can take the time to see what the patient needs if AI is taking your physical notes, whatever you're saying, whatever you're recording. AI Pulse. Technology has improved with monitoring your health so much so. They have AI stethoscopes that they can detect arrhythmia, they can detect pulmonary dysfunction, or like noises in your bowels that shows abnormalities beyond what your ears can hear. Because when you're listening as a doctor, you have noise. AI can cancel out that noise and listen to what they're supposed to, and then give you feedback. And if it's different from what you heard, then you can look at more details to do more tests, try to figure out what's going on. AI isn't seeing better, it's just seeing differently. It's giving you more insight. Did you know that radiomics can detect microscopic patterns in CT scans invisible to the naked eye? It extracts quantitative features from medical images such as shapes, intensity, and texture that go beyond what the human eye can perceive. We're not here to replace doctors. We're here to help. There are plenty of challenges. Automation, bias in data and medicine. We are the teachers of AI. So if we give them medical journals that may be outdated or that may have bias based on race or other determinants, then the AI will also be biased. It will go on those data. So we are the teachers of AI. We have to face these challenges with quality and oversight. And then we also have funding issues. All these tools that I'm mentioning, a digital stethoscope or a CT scan AI, all this costs money. And fundraising is hard. So it's not something that we can just roll out to every hospital and make everything better. But those are things that we have to deal with and try to make better. Implementation is also hard. And since AI is widely used, it's not just for the doctors. Patients come in with a list of their symptoms and say, this is what I have, treat me. You can't do that. You have to make sure what they're saying is true. As I know personally, I'll go to the AI and say, these are my symptoms, and this is what the doctor said, what do you think? And they'll come back and say, why don't you have this test done, but I'm not a doctor, so make sure you get the doctor's view too. But patients don't listen to that. They just hear, oh, this is what I have, and it fits. That's what I read online. All these challenges need to be met with sincerity, with quality, with understanding, empathy. And that's where augmentation comes in. Okay. Where we are a human-machine synergizing together to become the augmented healer, where its data and its speed and its pattern recognition is connected with your empathy, your ethics, your nuances, your decision-making, your context, your quality. All of that is you. That comes with the doctor. Jazakallah.